Good morning, my colleagues. A very warm welcome. Today we're going to discuss about indications for anti-prophylaxis in pregnancy. Let's look at the indication for anti-prophylaxis in first trimester, less than 12 weeks of pregnancy. With regards to laboratory testing, we do test the mother for her blood group and screen for the antibodies. But we don't test for any fetal-maternal hemorrhage at this week of pregnancy because the volume of fetal blood is relatively small. With regards to dose of the antibody, we administer 250 international units within 72 hours of any sensitizing events, including ectopic pregnancy, molar pregnancy, therapeutic termination, or heavy repeated bleeding along with pain. Note, we don't give antibody-prophylaxis for someone who's had a complete miscarriage at less than 12 weeks of gestation and where there's not been any instrumentation of the uterus, and someone with mild, painless vaginal bleeding with a closed cervix. Let's move on to antibody-prophylaxis in mid-pregnancy between 12 to 20 weeks of gestation. Remember, we do not perform any fetal-maternal hemorrhage testing up until 20 weeks of pregnancy, as the volume of the fetal blood remains to be small. The standard dosing is 250 international units within 72 hours of any potentially sensitizing event. So, 2 points to remember here. We do not perform any testing for fetal-maternal hemorrhage quantification up until 20 weeks of gestation, and the dose of antibody remains to be the same, 250 international units within 72 hours of any potentially sensitizing event. Moving on to antibody-prophylaxis at more than or equal to 20 weeks of gestation. Remember, here we test the maternal blood to quantify fetal-maternal hemorrhage. And why? Because the fetal blood volume would have been increased from this weeks of gestation. The dose of antibody is doubled when compared to what we've been giving at less than 20 weeks of gestation. So here we give 500 international units of antibody within 72 hours of any sensitizing event. And remember, this is in addition to the routine antenatal antibody prophylaxis the woman might have received in the same pregnancy. If the fetal-maternal hemorrhage has exceeded more than 4 mL of the fetal blood, we give additional antibody, and the dose is determined by the route of administration. If the antibody was given through an IM route, we give 125 international units for every extra ml of fetal red blood cell. And if it was given through an IV route, we give an additional 100 international units per ml of fetal red blood cell. And we do follow up the maternal blood sample at 48 hours of IV administration of antibody or 72 hours after IM administration to confirm clearance. And remember, for someone with an intrauterine death, we give antibody within 72 hours of diagnosis of intrauterine death, not from the time of delivery. We look more about routine antibody and prophylaxis and postpartum prophylaxis during a course that starts from January 2026 onwards. Thank you for your time and have a good day.